Good day everyone, my name is Wazir. Thank you for joining me today. Today I'll be talking about auricular hematoma, or better known as cauliflower ears. Auricular hematoma refers to the collection of blood between the perichondrium layer and the cartilage layer of the auricle. It is usually as a result of a direct blunt force trauma to the ear, and it is a common complication for athletes participating in combat sports such as mixed martial arts, as well as contact sports such as rugby. Now, while auricular hematoma may not be life-threatening or debilitating, it can pose a significant cosmesis problem, especially for the female athlete. Auricular hematoma is a result of the leakage of vasculatures inside the perichondrium from a blunt force trauma, and this blood pools in between the space of the cartilage as well as the perichondrium. When it is not treated or inadequately treated, it will result in neocollagen development, which ultimately leads to deformity, commonly known as cauliflower ear. Now, when asking question about cauliflower ear, it is important to get the history of a direct blunt force trauma to the ear, and especially amongst athletes who participate in contact and combat sports. This is because it will help us to differentiate auricular hematoma from other seemingly similar conditions which are differential, such as auricular abscess or perichondritis. Now, of course, other investigations such as blood investigation, fluid CNS, as well as ultrasound will help to further differentiate these conditions. Treatment for auricular hematoma can be divided into acute or chronic. Acute, or less than 48 hours, athletes or patients can benefit from drainage, and drainage can be employed via two methods, either aspiration or incision and drainage. For incision and drainage, the use of local anesthetic or auricular block may be necessitated. What happens after a drainage, either it's aspiration or an incision of drainage, a bolster dressing should be used to prevent reaccumulation of blood in that potential space. For chronic treatment, where deformity has already occurred and sets in, the only management that we can initiate is otoplasty. And for this treatment, it is important to refer these patients to the ENT specialist or a plastic surgeon to help with the management. When you are handling athletes, especially female athletes who express concerns with auricular hematoma, and especially when they participate in sports that has high risk of having recurrent auricular hematoma, it is important to discuss the expectations with the patient and have a low threshold for drainage whenever auricular hematoma sets in, to prevent unwanted cauliflower ear deformity. That's all from me. Thank you very much.